what you should know before you delay your pregnancy. This was the headline in the Times of India on the 25th of November 2021, which said, for the first time, India's fertility rate is below the replacement level. So, how to counsel and evaluate those planning to delay pregnancy? As a couple, you should know about the effect of delaying pregnancy on your overall reproductive health. The couple can temporarily delay pregnancy provided the fertility potential assessment shows that the female age is less than 35 and normal ovarian reserve, normal uterine cavity, normal semen parameters, and no history of tubal issue. Age, we know, has the biggest impact on the egg reserve, and therefore, age is the biggest factor affecting fertility. With advancing age, the egg forming capacity reduces in quantity and quality. The rate of this loss differs from woman to woman. The decline in egg reserve is generally seen post 35 years. However, this decline can begin as early as 30, also for some women. Therefore, it is a good idea to look for egg reserve post 30 years and plan pregnancy accordingly. So, what is the impact of low egg reserve secondary to aging? We see reduced fertility chances, increased miscarriage rate, and genetic issues to the child. The miscarriage rate increases with advancing age, and there is more than 50% chance of a miscarriage after 40 years. The chromosomal aneuploidy in embryos also increases with age, and there is about 40% chance of a chromosomal abnormality after 35 years. Male fertility declines with age, but more slowly than the females. The most fertile age for a man is before he reaches 40. Sperm motility, count, and shape, they decrease by 50% after 50 years. Testosterone levels also reduce as age advances, and this leads to erectile and ejaculatory issues. Age-related medical issues like diabetes, obesity also affect the semen parameters. Increased duration of smoking and alcohol consumption over years has a negative impact on the semen parameter. Semen analysis, interpreted by a WHO-trained andrologist, gives an idea about semen parameters and fertility potential. Now, what is the impact of age on uterus? As age advances, certain uterus-related issues like adenomyosis, fibroids might impose challenges for fertility and pregnancy. These conditions, they distort the uterine cavity and reduce implantation rates. The complications of pregnancy include miscarriage before 12 weeks of pregnancy in 11% of the pregnant women, miscarriage after 12 weeks of pregnancy in about 8%, preterm delivery in about 24%, fetal growth restriction in 11.8%, and postpartum bleeding. Fallopian tube status. Fallopian tube is the site where the sperm and the egg meet and fuse to form an embryo. The patency of the tubes should be checked in those with history of tubal ectopic pregnancy, history of tuberculosis, history of repeated vaginal infections, and long-standing lower abdominal pain. Now, medical issues with aging are diabetes mellitus, hypertension, heart disease, mental illness, and cancers. The long-standing and uncontrolled diabetes impacts the semen parameters in terms of count, motility, and morphology. Diabetes also has a negative impact on maternal and fetal outcomes during pregnancy. Blood HbA1c levels should be less than 6.5% before planning pregnancy. Hypertension is seen in about 13.8% for males and 10.9% for females in India. Hypertension in pregnancy is associated with fetal growth restriction, eclampsia, instrumental delivery like forceps or vacuum delivery, and cesarean section. Mental illness. The World Health Organization, that is WHO, estimates that about 7.5% Indians suffer from some mental disorder. The personal and professional stresses increase with age, and this has a negative impact on fertility and pregnancy. So, the mental stress in pregnancy causes increased risk of preterm birth, low birth weight baby, and intrauterine growth restriction. To summarize, pregnancy outcomes in relation to advanced mother age. Issues related to getting pregnant are decreased fertility, increased need for assisted reproductive technique like IUI, IVF, or ICSI, early pregnancy complications like increased risk of ectopic pregnancy, increased risk of miscarriage, increased risk of chromosomal abnormalities and genetic defects, late pregnancy complications like increased risk of pregnancy-induced hypertension, pre-gestational or gestational diabetes mellitus, preterm birth, bleeding complications, stillbirth, and C-section. Postpartum complications include increased risk of postpartum hemorrhage or bleeding, hysterectomy, increased risk of postpartum depression, and lactation issues. Now let us look at the long-term impact on the child development and psychology with aging parents. An increase in parental age might have consequences for the health and well-being of both parents and their offspring. There is a concept of sandwich generation, which is middle-aged adults aged 40 to 60 years who are caring for both growing children and aging parents at the same time. Challenges faced by them include rising financial pressure from two dependent generations, balancing a full-time job with family care, negative impact on one's mental health, and delayed plans in their personal life. So the options to preserve fertility and postpone pregnancy are egg freezing and embryo freezing. Always make decisions that prioritize your inner peace. Thank you.